Good afternoon. Thank you for joining us at the American Healthcare Provider Lounge Convention. Today we have Deb Meade from Health Management, owner located in Central Georgia. Deb, thanks for coming.
Thank you, Chris. It's great to be here.
Great. So Deb, why don't the viewers would love to hear a little bit about your organization, and then maybe we'll transition into some discussion about some of your challenges.
Okay, great. Majority of my properties are in Warner Robins, Georgia. I have assisted living that's 88 beds with 39 independent apartments. Then I have skilled care property there, 66 beds. Then in Macon, I have a facility that's 97 beds. And at Savannah, I have a 101 bed skilled facility. And then my most exciting project is back to Warner Robins. I just opened up a subacute skilled facility that we do a little bit of everything. We do hips and knees, we do cardiac, respiratory therapy patients, 2 wings set up for that, and then I have a long-term wing as well. So that's 106 beds. And it sits on 15 acres, it's 78,000 square feet. That's been my exciting challenge for the past year. We opened up a year ago.
Oh, it sounds simply amazing.
Thank you.
You know, it's a lot of work and a lot of time and attention in one, but you have multiple facilities, but extremely great reputation. But with all the payment reform and all of the regulatory changes, what are you finding to be your biggest challenge?
Staffing.
Staffing?
The biggest challenge is finding good quality staff that want to actually work in long-term care, because it's a calling. It's not a job, it's a calling. You have to love these people and love what you do and love what you're doing for them. And I love to say that you're going to make a difference in somebody's life every single day of your job.
Yes, that's excellent.
I get emotional. And finding that person is huge. Then when you find that person, you want to keep them, because they're a diamond in the rough. But not everybody stays. So then with the requirements of participation, one of the biggest challenges we're really going to face is the education piece and making sure that everyone has that knowledge, everyone gets that, and just constantly, it's going to require another staff member to do nothing but training.
And this is important for the viewers, because you see, the final rule or the requirements of participation are asking the providers to have competencies. So after you build your facility assessment and define what you have, every staff member needs to be trained. And what Deb's alluding to is that when they're training, if there's turnover or they leave, you have to retrain them. So, and again, retention is of course everyone's number one goal, but if the expectations are competencies, which we see and agree with, there needs to be some compensation, I think, on the federal level as well.
You're correct. I'm not opposed to it. I think it's great. I think the more education and the more we can do for these staff members, I agree with the requirement. But how do we get there, and what are the resources, and how are we going to pay for those resources? That's the whole piece that the owners, we're struggling with. And because we're currently, my building, it runs 40 Medicare. And we've sent 80% of our discharges home.
And let's pause for a second. When you have that volume, the outsider may not be aware that that's turnover and that's resources that need to be on that process.
Correct.
So that's very important.
And then the next challenge is that discharge piece. So we've got to start working, and we have been. I want to say my building is ahead of the game, because this is something that I strive for without a requirement. I want CMS to understand that we want what's best too. We're there. We know what we need to do. It's just getting those resources and those dollars to cover that. So the one discharge piece that we're not as good as I'd like to see that the requirements are bringing to us is that complete education to that family or that patient, and them understanding their diagnoses, side effects, every medication they're on, the side effects of those. But understand they come with 20 medications. So, and they're not going to understand. Reality is they're not medical people, and getting that piece to where they understand the challenges, that's going to be a challenge to us.
You know, in the final comments on that, when you talk about the continuum, and you talk about the skilled nursing facility versus the home care versus the assisted living, and you have a lot of the continuum within your organization, medication management itself, it can be essentially a full-time job. So, not that the industry would like the patient to stay under the roof of a skilled nursing facility, but I think there's a major underestimation of the value of the skills being provided. So,
Agreed.
so good. Listen, thank you so much for coming today. I hope you have a great conference.
Thank
and
you.
We'll talk soon. Thank you.
It's been a pleasure.
Thank you.